Hello everyone, happy Tuesday. We are back with Malpractice or Trial by Media, and today I'm going to dive a little bit deeper into the decision and order directly from the OPMC. So I appreciate everybody joining the last two conversations. We're just going to dive a little bit deeper. Siobhan, what's going on? How are you? I think you're a newbie here. Thanks for coming. For those of you that are new, and for those of you that haven't heard any of these conversations before, hey Carrie, what's going on? Hey Kendall, I think you might be new as well. Welcome, awesome. For those of you that are new, for those of you that haven't heard these conversations before or want to know what they're all about, I did do it a YouTube talk. If you go to my website, drdanielleroberts.com, if you go to Sovereignty, there's a little link for Malpractice or Trial by Media. If you click that, there's a video there. It's a YouTube video, and it basically goes through exactly what I experienced from the defamation campaign, the fear, the hate, the defamation, how that drove the legal system, the administrative court, to do what they did with my medical license and investigate my medical license for something that had nothing to do with the practice of medicine. 3 years after the original complaint was made and after they already issued a response that this wasn't the practice of medicine, and then still went ahead and investigated my license and decided to revoke my medical license ultimately. So that YouTube video goes through that whole story, and it will give you guys a good foundation and a good background for the conversations that we have here. The conversations that we have here talk about the question of whether or not what happened to me is malpractice. Did I do something wrong? Did I commit malpractice? Was I negligent in some way? Did I cause harm in some way? Or was this really trial by media? Was this really a case of social repugnance, prejudice, gossip, a whole bunch of other social issues that led political figures to try to protect themselves, namely Governor Cuomo, and make phone calls to have my medical license revoked? So that is the question on the table. That is the question for all of you to decide. And there are multiple other videos I have done in the past that we explore all sorts of different aspects of this question. You know, mainly a lot of the questions pertain around or revolve around, is branding the practice of medicine? So there are some videos in my highlights on Instagram, if you guys want to get caught up on those, that dive into, is branding the practice of medicine? Is it the practice of medicine if you're a doctor versus a tattoo artist or a layperson? I dive into, in the last two conversations, very specifically, the determination and order from the OPMC. The determination and order from the OPMC is a public document that's on the Department of Health website. And in that document, it gives their explanation for why they chose that branding was the practice of medicine. And it gives their justification, and it gives the page numbers from the testimony that they cite. So the last two conversations we went directly from that determination and order, and we've looked at all the page numbers that they were citing to justify their decision. And we found out in the last two conversations that all of the pages that they cited to justify their decision came from one expert witness, Dr. Grant, who is the prosecution's expert witness, who is a plastic surgeon, and all of their reasoning came from his testimony. So what I want to do with you guys today, we debunked, or at least discussed, all of their reasonings in the last two conversations. And if you guys have any questions from that, if you guys have thought about it, if you're not sure, you think it may have been malpractice, you think I may have done something wrong, please let me know. Please share that. But what we're going to do today is we're going to look at the expert witness on the opposite side, the expert witness that testified for me, Dr. Mayer, who is both a doctor, a plastic surgeon, and a lawyer, and his testimony, so that you guys can see what both the testimonies were and decide for yourself, is Dr. Grant's testimony the one that, the only one that should have been considered and cited, or should Dr. Mayer's expert testimony also have been considered? So, cool beans? Exciting? I think we can do it pretty quick too. Hi guys, hi Jocelyn, hey Kelly, what's going on? How are you guys? Hey Jean, you're back. I love to see your face. That's awesome. Nice to see you, babe. Will that debunking make it into the courtroom with credible weight? I don't know. I mean, I'm doing all these videos because number one, I think it's important to have history be documented in some way. You know, clearly my story has not been told by me. My story has been told by the media. My story has been told by the New York Post, by the New York Times, by HBO, by Stars, by Lionsgate, by all of the other people in the world besides me. So I am doing these conversations, I'm doing these recordings because I think it's extremely important as a historical document to have this documented in history. I hope at some point in my life that this will be documented in a documentary. I'll certainly probably write a book at some point, but that all of these videos become part of a historical record. So as we push towards my Article 78, I mean, I think also, you know, this is helping me process all of this information and continue to question, you know, did I do something wrong? Was this malpractice? Is it important for me to move forward with the Article 78? Do people care? You know, does anybody care that their personal rights are being infringed upon? You know, do you guys care that they could use the standing of my legal, you know, my medical hearing to revoke your state licenses? If you're a teacher, if you're a CPA, if you're a attorney, a doctor, do you guys care? I mean, should I be spending tens of thousands of dollars fighting this to protect myself and protect you guys? You know, part of this is also from, you know, I think this is important. You know, I think it's important to stand for this. I think it's important to have it be reversed. And I think it's important for me to ask all these questions and make sure that I'm doing the right thing. You know, am I moving forward doing the right thing? Or is this something I should just, you know, I should just let go of? You know, I did something wrong. I should just make amends, move on with my life, help other people, do it in a different way. Or is this something that's really worth standing for? And, you know, you guys, by either bringing people, sharing this with people, standing with me, you guys will tell me if this is important. You know, I mean, I know it's important. I want to do it for me and I want to do it for everybody regardless. But yeah, I mean, I can't do it alone. Not at this point. So, although my classes are doing great. So, we're getting close. So, I believe we do care. I believe you guys do too. I appreciate it. I can like keep leaning into the sun so you guys get like freaky. My eyes look crazy. I'm going to try to stay back here. So anyway, that's what we're going to go into today. You can just see like my nose must be... We'll talk about plastic surgery today. So maybe my nose is too big and it's darting into the sunlight. Okay, enough jokes. So we're gonna jump into the decision and order from the OPMC, and we're gonna go over what Dr. Mayer had to say in regards to my case. And then if you guys have any questions, please interject. Let me know. Let me know your thoughts. I'll do my best to answer all your questions as we go. So, okay, so the first part, at least you have some sun. You're damn right. I'm very happy about that, Jean. I'm very happy about that after being in Wisconsin for the entire winter. So I'm very happy to be in Miami right now. Okay, so a little recap. So the last two conversations, we looked at the decision and order from the OPMC. There are 2 points in that public document that address, there's 32 points total. In the decision and order, the board members who made the decision have written 32 points to justify why they decided to revoke my medical license. 2 of those 32 points speak directly to their decision that branding constituted the practice of medicine. That's point 13 and point 14. The rest of them have to do with the fact that if this were the practice of medicine, then I violated some standard having to do with the practice of medicine, which we can go through, but they're not nearly as important because, yes, if it was the practice of medicine, I didn't uphold medical standards. I upheld standards for the branding process, very clear standards. But the real important point and what this case is about is branding the practice of medicine. So those 2 points are the most relevant. Of those 2 points, in the last 2 conversations, I went through every single cited page that they had. So now I thought to round this out a little bit, like I said, that I'm going to give you guys Dr. Mayer's testimony because all of their points had to do with Dr. Grant. The prosecutor's expert witness, it was all his testimony. So now let's look at Dr. Mayer's testimony. So I'm going to give you guys a little bit of background on Dr. Mayer, just so you have his background. And I should do the same thing for Dr. Grant. I'll look that up for you guys too. But basically, he was he's a prestigious plastic surgeon. He's taught at teaching hospitals. He's, very well credentialed. He's published all sorts of studies. He's taught and sat on the ethics board and all sorts of different things like that. I'll get the exact credentials for you guys next time. But for Dr. Mayer, here we go. All right. He is... Okay, so my attorney is cross-examining Dr. Mayer and asking him these questions. And he asks him, what's the nature of your training? What's the background? What's the history? So he says, yes, of course, after graduating Lafayette College, I went to Cornell Medical School in Manhattan, New York. I was fortunate to graduate first in my class in Cornell. I did a 5-year residency in general surgery at New York Hospital Cornell. I completed that in 1978. I became certified by the board in surgery in 1979. I've remained certified by the American Board of Surgery to date. My board certification is current. Also, in 2010, I graduated Hofstra Law School. So he went to medical school and he went to law school. I finished second in my class in Hofstra, summa cum laude. I was on the law review the last year, and I took the New York bar exam in February 2011. I'm a licensed physician in New York, and I'm also a licensed attorney in New York. Okay, so those are his credentials. So he has both the medical and the legal degree. Now, let's go a little further forward. He's the chair of surgery. He took trauma calls in the emergency room for over 40 years. He's operated on over 25,000 major surgical cases. He supervised 250 surgeons in all different specialties: general surgery, plastic surgery, orthopedic surgery, gynecology. He trained medical students. So in a lot of ways, very similar to Dr. Grant, very highly credentialed, but also has a law degree and, clearly has those credentials on top of that. Okay, so now that we've established that, let's get to the good part. Okay, so in preparation for his testimony, he reviewed all the documents, he reviewed all the videos, he reviewed all of the background information from the hearing. So based on your review of the testimony that you have read and based upon the video that you saw in the statutes that you're now familiar with, did you reach a conclusion as to whether or not this branding procedure performed by Dr. Roberts was in fact a medical procedure in which she engaged in the practice of medicine in your expert opinion? And he says, in my expert opinion and testimony to a reasonable degree of medical certainty, Dr. Roberts was not engaged in the practice of medicine when she performed the branding procedure. In fact, she was acting as a branding tech or a scarification artist rather than a physician or an osteopathic physician. And then my attorney continues to question him and says, now, is that based on, give me 1 second, question, okay. Is that opinion based solely on medical facts, or is it a combination of facts that you have applied to the applicable law as you understand it? My opinion is based, so he answers, hold on, I want to make sure I pay attention to you guys too, my crazy eyes now. By that logic, is tattooing a medical procedure? Right, exactly. We're going to get into that. Is it Sean or Siobhan? I think it's Siobhan. I'm going to call you Siobhan. Clarify, please, if it's not. Yeah, we're going to get into that a little bit more in just a second. So, and yeah, we've talked a lot about that, but we're going to go through Dr. Grant's argument was that essentially the branding process was a cosmetic. Sean, perfect. I had a, all right, good. I had a Nope, not a gut instinct. That was about that. What was I answering? Lost my train of thought. So Dr. Grant argued that it was a cosmetic procedure, and therefore it's part of the practice of medicine. But we're going to look at the distinctions between the two today. We're going to contrast Dr. Mayer's definition of cosmetic surgery or cosmetic procedure versus Dr. Grant's opinion of what a cosmetic procedure is, and see if we in fact believe that branding is a cosmetic procedure, or is it not a cosmetic procedure if it's some other form of body modification or some other form of tattooing or something like that. Okay, so you guys will get to decide. Cool. The sun is going to drive me nuts, but I'm going to back up a little bit. Okay. So, next part. So, my attorney asks him, is your opinion based solely on medical facts, or is it a combination of the facts and the applicable law that you understand? My opinion is the basis. The basis from my opinion and is my training and experience as a physician and a lawyer, and my interpretation of the statute as applied to the facts of the case and the facts of the persons in the branding and the facts of the circumstances of the branding itself. Can you tell us why you feel this way based upon the facts? Of course. So it was my conclusion that the persons being branded did not perceive Dr. Roberts as their doctor or physician, and that no doctor-patient relationship was ever established. The women really didn't know who was going to brand them, and they didn't. They had no idea. Hey, Nellie, what's up, dude? Nice to see you, babe. Thanks for jumping on. So the women had no idea who was going to brand them, which is absolutely true. They had no idea until they got into the room that I was going to be doing the process with them. Had no clue. So there was no patient-physician relationship up front. But Dr. Mayer says the women didn't really know who was going to brand them. They were often brought to the branding room blindfolded, and outside of one friend that Dr. Roberts knew that she would be the one who would be doing the branding, who I believe is going to testify later in this hearing, the women had no idea that a physician was going to be doing the branding. Hey, babe. Okay, so why does that matter? So my attorney asks, why does that matter? Why does it matter that they didn't know a doctor would be doing the branding? And Dr. Mayer says, because to establish a doctor-patient-physician relationship is necessary to be engaged in the practice of medicine. There has to be a confidential relationship of trust between a patient and physician. If the patient has no idea a physician is involved in the scarification procedure, then a doctor-patient-physician relationship can't exist in the first instance. What's up, Randy? Also, Dr. Roberts didn't think of the persons being branded as her patients. Dr. Roberts took great pains to get special training in branding. You know, branding is not taught in any medical school. So certainly I have been around medicine over 40 years and trained at Cornell in some of the finest institutions, and branding is not included in any curriculum in medical school. It is not in any residency or fellowship, so Dr. Roberts had to study scarification or branding from technicians and receive a proper education. Also, if Dr. Roberts or any physician wanted to do the tattooing or branding piercing, for example, those two procedures require a license in New York State. And there is a physician hold on. Also, if Dr. Roberts or any physician wanted to do tattooing or body piercing, for example, those two procedures require a license in New York State. There is a physician exemption. Let's say Dr. Roberts decided to do a piercing. This is, you get the point. I mean, the whole point was that essentially, Dr. Mayer his opinion clearly states that he doesn't think this is the practice of medicine. He doesn't believe branding is the practice of medicine. He doesn't believe that there was a patient-physician relationship that existed before the branding. So when they cited Dr. Grant's testimony in the decision in order, they just completely, they don't cite anything from Dr. Mayer. I don't know if they didn't consider his testimony. I don't know, I don't know what their process was or what their logic was, but there's no consideration whatsoever of his testimony. Okay, so let's go a little bit further because this gets a little juicy, and I want to talk about whether you guys think branding is a cosmetic procedure a medical cosmetic procedure, or if you guys think that this has something else to do with body modification, tattooing, some other outside procedure or process. He goes on to say it was not done in a medical facility. There are no codes. Okay, so here's where he references the actual definition of the practice of medicine. So he answers, let's see, the question was, do you have this is the statute. So my lawyer's asking him about the actual law, the statute, about what determines, like what is the definition of the practice of medicine and what's not. So he answers, of course, the practice of the profession of medicine, and this is really key to understanding the issue before us. The issue before us really boils down to, was Dr. Roberts practicing medicine when she did the branding procedure? I argue absolutely not if we follow the words of the statute, which you all must, in my opinion. I don't. Sometimes there's typos in these transcripts, but it's kind of strange. So, which I argue absolutely not if we follow the words of the statute. So the statute 6521 states, the practice of the profession of medicine is defined as diagnosing, treating, operating, or prescribing for any human disease, pain, injury, deformity, or physical condition. So if we parse that out, let's see, that's the important part here. So you guys have already heard that definition. But basically, let's see, they go on to say, I'll just read it to you guys. Is this boring? Do you guys like this? Is this helpful? I feel like I'm reading you a bedtime story. I'm reading to you. I usually talk to you the whole time. So, but this is a lot of, I want you guys to know what the actual testimony says. So let me know if this is too much reading to you. We'll talk more, but I'm going to get through these parts and then we can talk about whether you guys think it's a cosmetic procedure or not. Okay. So parsing that out, the women that came as part of the initiation ritual for DOS, a secret society that was part of NXIVM, it's not part of NXIVM, but apparently everybody thinks it is, voluntarily having a brand procedure, and Dr. Roberts was not diagnosing, here's the important part, Dr. Roberts was not diagnosing any medical illness because they didn't have one. She was not treating a medical condition. She was not operating for any medical condition, and she didn't give any prescriptions or prescribe any drugs or therapy. So according to that definition, how is this the practice of medicine, right? So that's what we're all asking. I don't know. Okay. The women involved didn't have any human disease that was an issue. They didn't have any pain prior to the branding. They didn't have any injury. They didn't have any deformity or physical condition. So it's obvious to me, as a doctor and a lawyer, looking at the statute, that the branding was not the practice of medicine according to statute 6521, which has to control our inquiry today, because that's what the law is based on. So my attorney asks him another question. He says, let me ask you a question. You said that Dr. Roberts was not addressing any pain that the patients had. If you recall the testimony of Dr. Grant, here's where it gets good. If you recall, the testimony of Dr. Grant, the prosecutor's expert witness, who testified as an expert on behalf of the OPMC in this case, he seemed to think that cosmetic surgery is the practice of medicine because it deals with psychic pain. So in Dr. Grant's testimony, he basically said that cosmetic surgery is the practice of medicine because it treats a patient's psychic pain. So let's say I didn't like my nose that keeps jutting out in the sun. It's too big. It's getting too much sun. I didn't like my nose for whatever reason. I'm going to the plastic surgeon because I want him to change my nose, right? Now, Dr. Grant is arguing that I have psychic pain about my nose, and he's treating the psychic pain. He's not treating my nose. He's treating the psychic pain. That's his argument. And that cosmetic procedures are the practice of medicine because the condition being treated is the psychic pain. Now, I personally don't think that cosmetic procedures, I don't personally believe in a lot of cosmetic procedures. I mean, changing your breasts, changing your nose, changing all these things for aesthetic reasons. I mean, I personally believe that's a lack of self-love. And I think that lack of self-love or love for your physical body should be directly addressed by helping you build more acceptance and more love of every single part of you. My opinion. However, even if that were the case, doing a breast augmentation, doing a breast reduction, doing a nose job for a aesthetic reason. I believe that doing like if you have a deviated septum in your nose, or you have huge breasts that are impacting your back pain and all sorts of things, if it's impacting a medical physical condition, 100%, that's a medical physical condition, right? Then the cosmetic surgery thing makes sense as defined by the practice of medicine, but I don't believe it's treating psychic pain. However, if you're going to do a breast reduction, if you're going to do some sort of cosmetic surgery, those are very invasive procedures. They hurt like hell. They take a long time to heal. They have major health risks. Those are things that only physicians who are trained would be able to do. And clearly, if they do them for medical reasons, like a deviated septum or some sort of back pain, they're trained in doing the procedure. So it makes sense that if we're going to do it aesthetically, that a doctor or a trained physician would need to do that process. Still, there's a patient-physician relationship, and you're treating some sort of physical condition, right? I mean, if I walk in and say, you know, please change my nose, it's because I think there's something wrong with my nose. Or please change my breasts, it's because I think there's something wrong with my breasts. When these women came to the room, not knowing that it was even a doctor, it's not like they said, there's something wrong with my skin, please put a brand on it. Like, they didn't believe there was anything wrong with them. That wasn't the case. Like, it's not like, please fix this. Please fix my eyebrow. Please fix my eyelid. Please fix my sagging skin. Please fix my breasts. That didn't happen. There was nothing to fix. No condition, no, none of these things, right? So in my understanding of the practice of medicine, there was nothing being treated. There was nothing being fixed. Dr. Mayer agrees with that line of thinking, but Dr. Grant is justifying that aesthetic procedures are the practice of medicine because you're treating psychic pain. And he's arguing that the women who were branded were having psychic pain because they needed to feel like they belonged. They needed to feel like they were part of this group. And this brand was going to help them feel like they belonged. And that was the psychic pain that I was treating. So you decide. Tell me. What do you guys think? I'm going to read you the rest of Dr. Mayer's testimony so you have the complete thing. But what do you think? Do you think branding is a cosmetic procedure that treats psychic pain or treats some sort of medical condition that is a medical practice? Or do you think that branding is a body art process, a body modification process, a symbol that's done in a fraternity or sorority or between blood brothers or, whoever wants to do it, some other process that modifies your body away from the normal standard? You guys let me know what you think. I'm so curious. So, and then I'll read the rest of Dr. Mayer's stuff. So I wouldn't go to a plastic surgeon for my psychic pain. Carrie, I love you. I wouldn't go to a plastic surgeon for my psychic pain either. I would come to somebody who does the practices that I do with you guys in my other business. I would go to somebody who helps me. I can't do this sun thing. Wait. Hold on 1 second. Think about that. I'll be right back. My gosh, I should have thought about that before. So much better. Okay, now, where were we? Okay. There are private clubs or organizations that have initiations and brandings. Why is this case any different? Because we're women, Jean. We need protection. I mean, we're just widow women. We can't make decisions about getting brands for ourselves. We just can't make decisions like that. We need men to tell us what to do. I'm sorry, I don't mean to be so funny. So yeah, Carrie, I wouldn't go to a plastic surgeon for my psychic pain either. I would go to somebody who is qualified to help me heal mentally, right? Or somebody that helps people get mentally stronger, like in our practices and things like that. Little plug for my classes. So if you guys want to get mentally stronger, take my classes. Okay, Jocelyn. How can they just straight up ignore Dr. Mayer's testimony? Mind blown. My mind's blown too. But they did whatever they wanted in this whole process with me, Jocelyn. They did whatever they wanted from day one. Sarah Edmondson, May 2017, brought the complaint to the OPMC. The OPMC wrote a written response saying this was not the practice of medicine. It did not happen within a patient-physician relationship. We're not going to address this issue. Guess what? 2 years later, after the media amped up and people freaked out and everybody thought these women were victims of God knows what, Governor Cuomo was called out in the New York Times, made a phone call, and all of a sudden my medical license is being investigated. All of a sudden I can't practice medicine anymore. All of a sudden I can't get a job anywhere. Why? Because they do whatever the hell they want, right? So again, I'm speaking out about this because clearly, to me, this is a major case of trial by media. If we look step by step objectively at this process, do you consider one expert witness who's qualified or the other? If they're just looking at one expert witness, I think this is a little bit slanted. Just me. So anyway, Jocelyn says Dr. Mayer sounds like more of an expert witness here, in my opinion. I will read you guys Dr. Grant's credentials, to be fair, because I think that's important. But I do relish the support after being hated on for so many years. I'm just gonna soak it up. So, Sean, it sounds really silly to me. I don't buy the psychic pain narrative. Yeah, neither do I. Jeff's. Oh, hey Jeff, what's going on? Branding is a personal choice. Absolutely. Holly, what's up, babe? What would Hippocrates think? I don't know. What would Hippocrates think? And Randy, we talked about harm last time. So if that's a reference to me harming people, definitely watch the last video, because I broke it down, hook, line, and sinker, every single aspect of it. Really, seriously, if you're concerned about that, listen to the last video, and I go into very much so people and their decisions to call what I did harmful. Okay. All of a sudden, Governor Cuomo can't get a job anywhere either. Well, he made a few bad decisions. He killed a few thousand people based on his decisions, unfortunately. So, what's up, Antonio? A little late, brother. Good to see you. Oh, look at that. I can click on the screen and I can see all of your stuff. Amazing. Okay. Harm includes both physical and moral harm. Moral including traumatic and stressful. When people scream, you have moral harm. Yeah, 100%, Randy, except that she never screamed. We're talking about Sarah Edmondson. I have a video of the branding process with her that we did for the entire time that we were together in the room, and she didn't scream once. She did, nice, deep yogic breathing for the whole 2 minutes that the pen was touching her skin. She made jokes, fart jokes. She made jokes about her audition at Hallmark the day before, about being a badass bitch. She cried in gratitude, thanking us for what we were doing. So the fact is, Randy, people are lying. People think what I did was harmful because she said she was screaming in pain and forced to do this. So it's very important that things are kept clear. The Hippocratic Oath, in my opinion, is intent versus law. Yeah, but what was my intent? What do you project my intent was in helping these women? If it was a consensual process that we all respected, they came to me. They didn't come to me even in particular, but they joined us. They wanted to become stronger. They agreed to the brand from the beginning. What was my intent? What are you saying my intent was? Vicky says Randy needs to remember that Sarah's day job is being an actress. Yeah. You guys are all very funny. I love you all. But it's good. This stuff is important. We all come from different places. I do appreciate, Randy, bring up that controversial stuff. Not everybody on here has been willing to challenge me, and I think that's important. So just asking, what was your intent? Scarring, pain. My intent was to help these women become stronger. They wanted to become stronger. And remember, I had the process done first on myself. I would never do this with another human being without having it done on me first. So I knew what it felt like. I knew what the process was like. I knew what we were trying to achieve mentally and emotionally in building a sense of strength and solidarity among us in our vision to help coach each other to be stronger women, overcome our fears, overcome pain. 100% my intent was to make these women stronger. I think that comes across in every talk I've ever done. I was a personal trainer for years before I did this. You push people through pain to help them get stronger. You help support them through that process. So I hope that helps. That was my intent. My intent was certainly never to cause harm. It was never to scare anyone. It was never to force anyone. None of this, in my experience at all whatsoever, was coercive, was against anyone's will, was anything like that. So I hope that helps. Unbelievable how she could just switch up what exactly happened so it benefited her. Yeah, there's been a lot of that. And I think this week, stay tuned. There's going to be a lot of different articles coming out in the media. There's going to be a lot of legal filings. There's going to be a lot of different things going on. So hopefully a lot of this stuff will start to come out. Moira Penza, the lead prosecutor of the FBI, I think it was clear that she really wanted to win a high-profile case and didn't care whether whether the people involved were guilty. Wasn't really interested in the truth, but was very interested in winning. And, to a certain extent, this is human nature, right? We all have things that we want. Right? The question is, are we willing to step on other people and destroy other people's lives to get those things? And that's something we all have to ask ourselves. So, okay. Keep asking these. These are great. I really appreciate it. I really appreciate you guys engaging and asking the hard questions. I know some of these things are not easy, so feel free to challenge me. I think it's great. Let's finish Dr. Mayer's testimony, and then I'll let you guys call it a night, okay? Okay, so we're going into the psychic pain stuff. Let me ask you a question. Dr. Roberts was not addressing any pain that the patient had. If you recall the testimony of Dr. Grant, who testified as an expert on behalf of the OPMC, he seemed to think that the cosmetic surgery was the practice of medicine because it deals with psychic pain. He likened that and understood, as I understood his testimony, to some kind of psychic pain that the people were being branded. Can you comment on this? So Dr. Mayer says, in response to this, I read his testimony carefully. I didn't find it credible because, women are coming to a plastic surgeon, or men or women, because the plastic surgeon is evaluating and operating on a physical condition. When a person goes to a cosmetic surgeon, whether for their own perception that their nose is too big, they have wrinkles, droopy eyelids, the cosmetic surgeon is operating on a physical condition. Often that cosmetic surgeons, in their operating note, which Dr. Lapidus can certainly attribute to, Dr. Lapidus was on the board. He was one of the doctors that was making the decision about whether to keep my medical license or not. And he says, So he says, often that cosmetic surgeon in their operative note, which Dr. Lapidus would certainly attribute to, this is correct that they would dictate deformity of the nose or call it a deformity, but it is definitely a physician, is definitely a physical condition that they are addressing. A plastic surgeon is not operating on psychic pain, they are operating on the body, the patient's perception of their body, and they're correcting a physical condition. There is a form of plastic surgery that is operating on major deformities and corrective surgery as well. In branding, there's no physical condition on the body that the branding technician is addressing. There's no deformity, there's no disease, there's no physical condition that is being addressed. So plastic surgery is the practice of medicine, not because it addresses psychic pain, which I think is an absurd argument, but because it addresses a physical condition of the body. Branding does not address a physical condition. That is why I argue that cosmetic surgery is the practice of medicine, that branding is not the practice of medicine. So that's Dr. Mayer's testimony regarding whether he thinks this is a cosmetic procedure that would be the practice of medicine, or that he believes that this is not a cosmetic surgery, not treating some sort of condition. So, why did you block the sun? I don't care if I catch fire. I just couldn't see you guys well. Now I can see you, you can see me. It's fabulous. All right, let me see if there's anything interesting to wrap this up for you guys. I think that's pretty much it for today. What do you guys think? The media are a bunch of Karens. Yeah, no. It is what it is. Let's keep, educating people. Let's keep making people aware. Let's keep doing this. Please, 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 please bring people to this talk. Share this video with people, especially doctors, especially attorneys, CPAs, teachers, insurance agents, anybody licensed as a state licensed professional. They have revoked my medical license, something I worked 12 years for, overnights, incredible amounts of sleep deprivation, all sorts of things, over $300,000 in loans and debt to be able to put myself through medical school so that I can help people. They revoked my ability to make a living and to practice medicine because they did not like what I was doing in my personal life. And again, you guys decide for yourselves, but I'm giving you all the data. I'm giving you the data of how they made their decision. I'm giving you the data of exactly what I went through, of exactly what happened with the media, with Governor Cuomo, with the Office of Professional Medical Conduct, the complaint, the decision in order. We're going through everything together. I have nothing to hide. You decide. Was this medical malpractice? Did I do something wrong? Or was this trial by media and they revoked my medical license because they didn't like what I was doing in my private life? They didn't understand it. They had a whole bunch of women complaining about it, and they felt like they needed to save face and just couldn't, have the courage to stand against the narrative that was in the media. You guys decide. And if you decide, which I don't know, and I don't know, if you decide that they did this because they're peering into my private life and essentially deciding that they're going to take my medical license because they don't like what I was doing in my private life, then guys, we need to stand up for this, and we need to stand up for it fast. The Article 78 is coming. Please share this with people. Please go to my page, go to drdanielleroberts.com, hit get involved. It'll take you to a donation page. Please contribute so I can pay my lawyer and we can reverse this. And they can't cite my case. If somebody makes up a lie about you, if somebody says, oh shit, he raped me, or oh shit, he grabbed my ass, or you know what? I don't like that they didn't have their kids wearing a mask on the plane. If they go and they make a complaint about you to your board, to your administrative court, they can cite my case to be able to take your credentials away. If you do not want that to happen, if you want the right to live your private life and make your choices in your private life the way you want to make them, please, 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 please share this, stand with me, contact me, figure out some way to get involved. I love you guys. Thank you so much for all of your support. You have been amazing. Let's finish this race. Let's get it over the finish line. Let's make this happen. Let's get me my medical license back so I can help people actually get well, get strong, mentally, emotionally, physically, all of the things. Let's do it. So I love you guys. My courses are going great. The next one is June 5th. Please DM me. I'm going to do 2 new workshops. You guys, I asked you questions. I asked, would you like to know how to master your stress response? So your fight or flight response, your vagal nerve, your stress response. Would you like to master that and know how that works? Or would you like to master your neuromuscular response? Turning on certain muscles, activating muscles, muscle fibers, becoming aware of how your whole body works so that you can function to optimal ability, be fully connected, fully alive, fully engaged in your life, and increase your performance, increase your balance, prevent hip surgeries, knee surgeries, balance issues, falling and breaking a hip, all these things. And it was 50-50. I mean, it was 60-40. It was, 6 to 5 essentially. So I decided to do both of the workshops for you guys. 2. One is going to be 2 weeks from now. The other one is going to be the week after. So you're going to do stress mastery, and then we're going to do neuromuscular mastery or body awareness. So if you guys are interested in those, if you want to get a taste of some of the stuff that I do, come sign up for the website, DM me if you guys want more details, and you can do a workshop. And then the next big training is going to be June 5th. So you'll get it in ahead of time. You'll get it in beforehand and see if it's something that you may want to do for yourself for the other picture. And again, all those proceeds are going to go for paying some of my bills, of course, so I can eat. And then the rest of the proceeds are going to go to standing for this cause. So thank you. I love you guys. Keep doing the good thing. Let me answer any more questions there might be. Was there an issue with how the women consented to the procedure? Sean asks, was there an issue? Not in my experience. Every single woman was presented with the same process up front. They were all told the same things when they were asked if they were going to join the sorority. There are other videos on this too, Sean, and we can talk more. But every single one of them knew that there was going to be a brand, and every single one of them consented to being part of the organization. So, again, this wasn't a medical procedure. It didn't require a formal written informed consent. There was consent on video also, with them asking for a brand and being part of that process. So, I believe on multiple levels. There was no body language that they didn't want this. They had never told me to stop, that they didn't want it. They, weren't trying to leave. They were thanking me for the process. And certainly as far as I know, and I didn't invite any of these women to DOS, but any of the people that did invite them, what was communicated to me was that they all wanted to be in the organization. They all knew there was going to be a brand. They all were fine with that process coming in, and that was that. So, thanks for putting up with my wisecracks. You did nothing wrong. I love you, Jean. Mwah. Thank you all. Sean, thanks for coming. I know you were new, and thanks for asking questions and participating. So, I will see you guys on Thursday. Have a great 2 days. Bye.